To all, myself Dr. Reena Thakur, Professor, Index Nursing College. Today I am going to deal with the investment in nursing. As nurses deal with the patients on an individual basis and hence a special insight into their specific needs. Nurses are a part of integrated teams in making critical contributions towards universal health coverage and other national and global health objectives. During the COVID-19 pandemic, we all know that nurses across the world they worked tirelessly, continuously to prevent deaths all over the world. The COVID-19 has exposed the weakness caused by underinvestment in health system around the world. As we all know, during that pandemic, there were so much shortage of hospitals and the health facilities. The nursing workforce is expanding in professional scope. However, the expansion is not sufficient to meet rising demand and is leaving some populations behind. As the global nursing workforce is 27.9 million, of which 19.3 million are professional nurses. This indicates an increase of 4.7 million in the total stock over the period 2013 to 2018 and confirms that nursing is the largest occupational group in health sector, accounting approximately 59% of the health professions. Why there is a need of investment in nursing? Because nurses are important to ensuring the quality of care and patient safety, preventing and controlling infections, and combating the antimicrobial resistance. And this will be achieved through carrying out multiple functions, including monitoring the patients for clinical deterioration, detecting the errors and near misses during clinical practice, implementing infection prevention and interventions, control monitoring and mentorship, and ensuring that good practices involving water sanitation and hand hygiene are maintained. In the outbreaks like COVID-19, where hand hygiene and physical distancing and surface disinfection are central to containment and the infection prevention and control role of nurses is crucial. The global shortage of nurses brings the need for investing in nursing education, job and leadership. As we all know, there are shortage of nurses in so many countries and they continuously trying to produce more and more nurses, more and more educated and qualified and registered nurses. The investment required will necessitate additional financial resources, and if these are made available, the returns for societies and economies can be measured in terms of improved health outcomes for billions of people, creation of millions of qualified employment opportunities, particularly for women and young people, and that will enhance the global health security. Investment in nursing education. Investing in nursing education. We can invest in nursing education by nursing education by faculty, by providing proper infrastructure and students to address the global needs and meet domestic demands and respond to changing technologies and advancing models of integrated health and social care. As our education should include that much of syllabus so that we can fulfill all the domestic and global needs demands, and also the students will achieve the models of integrated health and they will advance in new technologies. Now, investing in nursing jobs. As there is shortage of nurses, so we have to create at least 6 million new nursing jobs by 2030, primarily in low and middle income countries, to offset the projected shortages and redress the inequitable distribution of nurses across the world. By investing in nursing jobs, we have to create at least 6 million jobs worldwide, so that new nurses can be produced, and the new nurses will be advanced in the advanced technologies, and they should be provide their services all over the world. Next is investing in leadership. Strengthen the nurses' leadership, both the current and the future leaders, to ensure that the nurses have an influential role in health policy formulation and decision making, and contribute to their effectiveness of health and social care systems. We all know that the nurses are never involved in the health policy formulations, though it is now essential to bring our leaders in front, and nurses leaders should also involved in health policy formulations and decision makings, and they also contribute to the effectiveness of health and social care system. Now some future directions for increasing investment in nursing workforce. Countries affected by shortage will need to increase funding to educate and employ at least 5.9 million additional nurses. So in our countries, we know that there will be shortage of nurses, so we have to increase the funding for education and employment of nurses. Nurses' mobility and migration must be effectively monitored and responsibly and ethically managed. The nurses' education and training programs must prepare graduate nurses who drive progress in primary health care and universal health coverage. Nursing leadership and governance is critical to nursing workforce strengthening. So actions should include establishing and supporting the role of senior nurses in the government responsible for strengthening the national nursing workforce and contributing to health policy decisions. The policymakers, employers and regulators, they all should coordinate and support the decent work of nurses. Country must provide an enabling environment for nursing practice to improve attraction, deployment, retention and motivation of the nursing workforce. Adequate staffing level, proper workplace and occupational health and safety must be prioritized and enforced, with the special efforts paid to nurses operating in fragile, conflicted and affected and vulnerable settings. All the professional nursing regulations must be modernized, and actions should include harmonizing nursing education and credentialing standards, instituting mutual recognition of nursing education and professional credentials, and developing interoperable systems that allow regulators to easily and quickly verify the nurses' credentials and disciplinary history. So we have to make the nursing regulations, and that regulation should be modernized and according to the current scenario. Next is collaboration. The collaboration is a key action which include intersectorial dialogue led by ministries of health, government chief nurses, and engaging the other relevant ministries like education, immigration, finance, labor and stakeholders from the public and the private sectors, so that the nurses who have been trained in India and they can work in abroad properly. Next is investment opportunities. Home health care. Home health care is a unique not only because care is provided at home, but it also usually less expensive, more convenient, and it can be just as effective as the care given in a hospital or skilled nursing facility. Home health care saved or real estate and infrastructure as a model effectively operate at 15 to 30%, reduce the cost in comparison to hospital expenses for similar treatment, and it is estimated that the home health care has potential to replace up to 65% of unnecessary hospital visits in India and reduce the hospital cost by 20%. Next is telemedicine and other technology related health services. The market size for telemedicine in India is around $830 million in 2019, and it will be projected to increase 31% in future. The telemedicine practice guidelines were released jointly by the Health and Family Welfare, Ministry of Health and Family Welfare, and Niti Aayog in March 2020 to ensure that access to medical advice does not become challenging due to social distancing norms and enforced following the COVID-19 outbreaks. Technology in nursing care and practice. As finding from a Cochrane systematic review of health workers and experiences in primary health care, it will suggest that health workers, including nurses, have appreciated the benefits of using mobile technologies in their delivery of healthcare, but they have also encountered challenges. The benefits described included being more connected to each other, taking on new tasks, improving coordination and quality of care, improved communication with clients and accessing clients in hard to reach areas. Conclusion. The nurses represent the largest occupational group, representing a central element of primary health care and health system in countries of all the levels of socio-economic development. They generate massive investment in health workforce and in nurses as a part of this, leverage them for multiple development outcomes including job creation, policy implementation and youth empowerment. Optimizing the return of current investment in nursing through adoption of required policy options in education and decent work, deployment practices, productivity, regulation and retention of nursing. So today's world is a very fast changing world, and in this world it is important for us to change day by day, and this will require more and more investment in nursing by our own governments and by the world health level also. World level, we have to change our views and we have to invest more and more in nursing. Thank you. That was all about the investment in nursing. Thank you.